Welcome. And Mike, I'm going to turn it over to you to do the tutorial, and then I'll do my little contextual thing afterwards, and then we'll open it up for questions.
Okay, sounds good. Hi, I'm Mike Steele. I'm a senior policy analyst at Chapin Hall. For quite a little while now, I've been doing a lot of these service array gap analyses for different jurisdictions around the country, sometimes related to FFPSA, sometimes not. And I wanted to follow up on the presentation I gave a few weeks ago by just demonstrating a quick way to look at a gap analysis that you might be able to replicate. So let me share my slides. Okay, so today we're going to talk about a mental health example. Obviously, we could do this for a whole bunch of different services, but I thought this one would be the easiest to illustrate. And just a reminder, a spatial gap analysis or any kind of gap analysis is a way we can use location to understand the imbalance between the needs of a population and the resources available to meet those needs. And we can do this, at a global or some kind of sub-geography level, which is to say we could look at the totality of your county or your state and say what are all of the needs and what are all of the services, or we can break them up into smaller bits and understand the distribution over a particular space. And so today I'm just going to show you kind of how to do a quick baseline analysis to compare yourself to other counties. Just a quick note, even though I'm showing this at the county level, all the data I'm going to show today is also available at the zip code level. So you could actually do this within your county rather than just comparing your county to other counties. Any kind of gap analysis really requires two sets of data on resources, which is supply data. So how much mental health how many mental health service providers do you have? And data on needs. How much of your population actually needs a mental health service? My hope is that at the end of this quick demonstration, I'll be able to show you a county level gap analysis, demonstrate where you can find some of the information around mental health supply and demand data, calculate a quick rate, and then show you a simple baseline analysis graph. So there are three sets of data we're going to look at today. We need population by county to start with, so I'm going to show you how to get that out of the census using their American Community Survey data. I'm going to show you how to find some mental health services by county. And we're going to use more census data called county business patterns. And then thanks to the California Healthy Places Index, you have a handy source for mental health need by county. And again, all of this data you see here is also available at the zip code level. So let's start with population data. This slide is meant to be sort of instructions for you. I'm going to jump out of the presentation now and show you how to do this by hand. But when these slides are shared out, if you follow these steps, you should be able to sort of replicate what I'm about to do at the actual website. So we're going to start with data.census.gov, which is the main portal for census data. This site is, from a government perspective, relatively new, which means there are all kinds of bugs in it still. But big parts of it do work well. So the first thing we want to do is click on this advanced search button, and it brings us up to this page. And if we just type in the search bar, total population, it'll return a whole bunch of information. And if we scroll down a little bit under tables, the third one down is just total population. And so what we're looking at here is data for 2020, and this is a 5-year estimate, which means it has a very small margin of error. And this is the American Community Survey. So this is not the decennial census where they come and knock on your door. This is a survey that they do every year, and you can pick all these different years if you want. I'm just going to stick with 2020. So it's defaulting to the United States population. So I'm going to show you how to adjust this so you can get it for California. The first thing we're going to do is change the geography. So if we click on geos, we get some choices. I'll click on county, and then we just select California as the state. And then the big trick here is rather than clicking on every county, just click all counties within California. And then once you've got that, you can hit the X and close. And now you can see we've got an estimate and a margin of error. Because it's a survey, there's a margin of error on every single estimate, which is really their count. we don't necessarily need that. So if you just click this little plus minus button, we can get rid of all of those margins of error. And then if you don't want it in this row format, it's very easy to hit the transpose button and make it into a nice column. And then you can see the total population for every county in California. And if you want to pull this out, you can just click on the Excel tab and it'll just download right to your computer a nice little Excel worksheet, or workbook actually, because there's a second tab that gives you all of the metadata around how they collected it and the limitations. But this is a great website to go to understand your county relative to other counties. You can pull out data on single family households, you can pull out data on poverty, on all kinds of information that will help you understand your county relative to the other counties in California. Okay, let me go back to my slides. Okay, so now we have at least a base of population. So how do we find supply data? So there's a really good source of data called the County Business Patterns, which is also it's an annual survey that has a really high completion rate. It's usually used in economic development, but it can be also used to understand the number of establishments that provide human services like substance use, disorder treatment, and mental health services. You could also get that out of data.census.gov, but that part of the website is broken. So I'm going to show you a different way to get it. And that's by going to this link here, which is the Programs and Surveys button. And so again, these steps will just kind of replicate what I'm about to show you on the actual website. Oh, I'm sorry, but a word about, there's a really important part of this I almost skipped. The trick to accessing county business patterns is something called NAICS codes. And so what these try and do is categorize every establishment in the entire country into a 6-digit category. And in this case, we're going to use this category, 621330, which is actually offices of mental health practitioners except physicians. Now, how did I find 621330, right? The way I did it was with this website. It's a search website where you can punch in pretty much whatever you're looking for and get back the code that you want. So it just looks like this. And I'll just clear this out. And just as a keyword search. So I'm going to type in mental health. And what you'll see is there's a lot of codes for this. So here are all of the codes that have some relationship to mental health. I only picked one of them. This one down here. Where was it? 621330. Oh, I think it's at the top. Here it is. So you may want for your county to pick multiple codes to decide, what you think is or is not in your service array. So I'm just picking one today to demonstrate how it works. But you can see there's lots of different ways to look at this data. Okay, so once you have your code, you'll go to the County Business Patterns page. And again, the link is on the slide. And this is a little bit tricky. You've got to scroll down a little bit down to this Visualizations tab and click on this map. And so this is a great way to see this data by county or by state for the whole country. And what's really great about this data is it tells you not just the number of establishments, but it will also tell you the number of employees. So once you know the number of establishments in your county, you can get a sense of the size, right? Because you could have one provider that has thousands of, practicing mental health employees, and not know it. So the first thing we're going to do here is pick California. And then it'll take us to the state. So hit view state. There we go. And then I'm going to pick how I want to find this. So I have a 6-digit number, which is the most detailed categories I can get. And I want to turn off the all, because I don't want all businesses. And then I've just got to scroll down to my number, which is 621330, which I found on the other site. $621,330. And then if I scroll down a little bit and hit apply, it's going to show me how many businesses there are by county that fit that category. And you can see if you wanted to pick other ones, you would just keep clicking on the radio buttons and it would give you the total. And so now you can hover over any one of these counties. Fresno County has 57 establishments that meet that code. And you can see it's kind of a low number because we've only picked the one category, but I wanted to keep it kind of simple. This is a nice way for you to know how many you have in your county. It's a little bit of a drag if you want to get them all out. That's what the data.gov site should have done. But given that that part of the interface isn't working well, what you can do here is get this data out of the county business pattern site directly. So if you click on this, if you wanted all the data for all the counties, you can go back to this and then you just click data sets. And they've been collecting this data since the mid-60s. The website will give you data up to 86, although I don't know that you need to go back that far. And then if you just click on any given year, it'll take you to a page where you can just download all of the data. So the complete county file. So this is all of the business data for all of the counties in the US. And once you download that, you can, with a 6-digit code, pull out whatever it is you want to see. So this is how you would get at the tabular data if you wanted to do that. So now we have population data and we have a supply data. We know how many people live in a place and we know how many mental health providers there are. So the need data is pretty great. The Healthy Places Index data will help you get this data. Now, it seems complicated because you have to build an account, which actually is really simple. And they talk about this API key, but it basically populates all of this stuff automatically. And eventually it just gives you a link that you pop in your browser and it automatically downloads the data you're looking for. So while there are a lot of steps, it's not particularly difficult to accomplish any one of them. The trick is finding this data download link. So I want to show you how to do that quick. So when you get to the landing page, you just visit the map. And the Healthy Places Index is a summary statistic that combines a whole bunch of variables together to look at the total health of any given place. All right, so why is that not working? Oh, it's loading. Sorry, it's just going to take a second apparently. There we go. Okay, so you can look at any one of the variables that makes up the summary statistic. And like I was saying, you can look at this at the county level, but you can also look at it at the zip code level. So if once you compare your county to other counties and find out that you have a need, if you want to find out specifically where in your county that need is, you can switch to zip codes. I'm going to keep this focused on counties.
There's a question in the chat. If you select more than one code, is there a risk of duplication in the result?
I don't believe so. My understanding is the categories are mutually exclusive. The problem with that is did some provider, like maybe some providers in like a big hospital system, did they get put in a healthcare category rather than a mental health category? That I can't speak to, but they should be mutually exclusive. If you sum them up, it should equal the total number of businesses in your county. Okay, so again, here, what's great about this is you can see the overall score, but if you go into tools, you can look at any individual indicator and you can map it. Or if you go all the way down to the bottom and you click on download data, it'll take you to this page to set up an account. And like I said, this is not particularly difficult. You set up this account and then it gives you this API key and you just basically cut and paste that into a request form to get the data that you want. So I would highly recommend playing around with this data. There's a lot of good stuff in here. And I showed a lot of that in the training from a few weeks ago. So for the sake of time, I'm going to jump forward here a little bit. So now that you've got population data and you've got supply data and you've got need data, all you have to do is divide the total number of mental health providers by the total number of people who need mental health services, and then multiply that by some number like 10,000 to get a rate. And you can compare, you know, apples to apples, county to county, and create a baseline analysis graph. And that's a fancy way of saying it's just a bar graph with a line on it. And the line is the average for the state. So the state average is about 7.5 mental health providers per 10,000 residents with a mental health need. So by putting that on this graph and then doing the same calculation for every county, you can see there are a handful of counties in California that are above that rate, some quite a bit above, and quite a few that are below, some that have no providers at all. And so if I'm Butte County, I can find myself on this graph and say, hey, I'm at 4.7 providers per 10,000 residents, which puts me below the average. I may have a gap relative to my need in comparison to other places in California. So this helps you start making the case that you may need more services in this category. Now, the problem is this is a relative measure, right? So for all we know, 7.5 is low in general. It's not a great benchmark, but at least you're starting somewhere. You know where you fall relative to other counties. And if you were to pull this data out at the zip code level, you could replicate this within Butte County and find the handful of zip codes that are probably, that have a need that are well below, and start, trying to put resources there. So that was a lot. I'm going to stop here, and I want to have some time for questions. I didn't see if there are any in the chat, Kush. Did you see if there are any more?
Not after that one I just asked you.
Okay.
So questions for Mike that have come up right away? Look for some hands. You can raise your hand. You can come off mute. This is a conversation, so feel free to jump on in. One of the contextualizing comments that I'd like to make here is, so not every county has Mike Steele to have them do their analyses for them, right? And the other thing is, it's going to be really overwhelming if you're sitting back going, gee, I don't know which populations I want to serve. Let me run some analyses, right? You already have hunches with regard to what you see over and over and over with regard to assessment data, histories of the folks that come to the doors of our systems. Probation knows, child welfare knows. You have hunches like, oh, maybe mental health is an issue here, and we're not addressing mental health needs, and that's why our families get put at risk and then get further and further upstream into the system. So then you would do something like what Mike did to validate that. You have community listening session data that you've already created. Either child welfare's done it, public health's done it, behavioral health's done it. You could go back to those notes from those sessions and gather qualitative data. So you don't have to survey the community all over again if you already done it. So, the point, again, just the point I'm trying to make is there are hunches you already have about what might be going on that if a need were addressed, you'd have folks not enter systems, and then you want to do analyses like you're seeing here to validate those. You've already done a lot of work for the majority of you. You're not starting from scratch. And if if you're child welfare and you don't know this data, look to your peers. They've done these analyses. They've looked at the community. All right, so we have a couple of hands. Deanna, go ahead.
I may have to jump off. We have a lockdown drill scheduled, so I may just disappear in the middle of my question. But
Okay.
My question is, can you take the data that you just pulled out about behavioral health providers, and then can you do another level of, let's just say we have 100 behavioral health providers in this survey, but we know only 25 of them take Medi-Cal and Medi-Cal. Like, can we add another layer? Is that okay if we have other external data to apply to this?
Yeah, the problem with that county business patterns data is it's not going to tell you the individual providers. So
Right.
I would suggest at that point moving to like 211 data. Like those websites are pretty good about showing you where individual providers are, and they have a lot of information. I would suspect San Diego and LA will have data on whether they take Medicaid or Medi-Cal right on the site. I don't know about the other, there's a broader 211 for all the other counties. I haven't looked at it close enough to know. But what I would say is in other states, We have found local 211s to be great partners. Setting up a DSA with them is really easy because all of their request for help data is anonymous at the source, and all of their provider data is public information. So we set one up in Maine in like 30 days. It was really easy. Lawyers
That's
looked
a
at
data sharing agreement for those.
yeah, and then they gave us all the back end data, which let us really see things like what was just asked about.
All right, Waldy, did you still have a
Yeah,
question? Yeah,
I
go
actually
ahead.
had the exact same question. So,
Huh?
you know how far you can drill down with this database.
Great, thank you. Other questions or just suggestions for each other with regard to where you've been looking and where you've been stuck, or any other questions for Mike about, I don't know, I'm looking for this, where would I even go find that?
Nicole from San Francisco came off mic. Did you have a question?
I was going to ask a similar question, but I maybe just kind of making the comment that this is great, but going down that same road as the other two before me, like being able to understand kind of the why behind it. So one of the things I noticed on your bar chart there, Mike, was, it says San Francisco has a high level of providers compared to need and compared to other counties. But what we hear is that that's maybe not the case at the ground level. And so kind of exploring the why behind that, which is getting to the next level of being able to address that problem.
Yeah, access to care is a very complex question, right? Like the first level is proximity. Are you near it? Can you get to it? But then there's so many other questions about language, about payment, about service type, what populations they serve.
Yep.
So there again, I think in most cases, the 211 is a good place to start, but even there you may find yourself a little frustrated. Some places we've been have started with that data and actually called. They've done surveys to say, here's what I need to know. Oh, there's one other resource that might be useful. There's a website called findhelp.com. They're a private service referral company, but they allow public access to a limited slice of their data. I've found that site very useful in terms of finding things like payment type. So you might also try exploring that.
Lori, go ahead.
Hi, thanks. So, Mike, first of all, thank you for making this so easy and straightforward. I'm sitting here thinking even I could find out some of those data points. So really appreciate your approach. My question for you is if you have a comment about level of analysis for this kind of work. So, for example, we're trying to look at some hotspot neighborhoods and thinking about wanting to do analysis by sub-regional areas because those define a neighborhood, but they cross zip codes and sometimes cross census tracts. So are we going too deeply? Is there an easy way to do that? Just maybe give us some comments on that.
Sure, I think it's a great question, and it becomes more complicated depending upon how big your county is, right? So the great thing about the Healthy Places Index data is you can go down to the census tract if you want, and the same thing with the census data. And now you've got a really powerful tool there to try and find these hyper-local areas of need. I've been in states like Illinois where they have really great provider data, and they have point level data for kids' needs because they have assessments on all of them, where we could have point level data for kids and providers and do really complex geospatial analysis about where that falls. But the problem is neighborhood boundaries seldomly line up with census tracts or zip codes. There's always some kind of weird overlap. And so I would say not to let perfect be the enemy of good and get as close to you can. Certainly when dealing with the public, people know their zip code. They have no idea what census tract they live in. So as imperfect as zip codes are, they're a great way to sort of divide up the county if you want to communicate to the public.
Great point. Thank you.
Other questions? Go ahead, Waldy.
I have one, and this is, I don't even know if it goes here or somewhere else. So in Mendocino County, it's always the same people who participate in all of the same things, like the assessment, the needs assessment and everything. And then if I go down in the data, it is still that kind of data. So how do we think about I guess, out of the box, out of the normal data that we always have, you know, data that we are missing, that we don't even think about it. Yes, I can think, okay, we have tribes, we have, you know, a Hispanic population, but there's still maybe another subgroup that I don't even think of, right? Because it's always the same people. How do we get to that kind of data? Because if I go look, I have a certain idea in mind what I'm looking for.
I mean, I think that's a great point. If you really think about it, the census doesn't include everyone, right? Those surveys that come out every year, if you don't pick up your phone, you don't have a phone, you don't get reached, you're not counted. So there are always groups that are missing from these large administrative data sets. And I think the only way to really get that kind of feedback is to start, you know, really approaching the groups you're interested in, getting their feedback. I've done some real hyper-local stuff where we've done community involvement, where we've shown them census data and said, what are we missing? And we've gotten some really awesome feedback from community members who are like, well, I don't see this reflected at all. And then that turns you into like a detective, right? Then you have to run after that thing and see, is that just one person's experience, or is there really a thing here? And sometimes it turns out there really is a thing and you've just missed it. So I think that's an excellent point.
Thank you.
And you know, there's just to that point, one of the thoughts I have is you've got to start somewhere, right? And ideally, you will start to reduce the number of children and families in the deeper ends of care, right? And then you shake loose some resources because your first cut at prevention has succeeded, your first iteration, right? And then you can take on more, right? So you could start somewhere where you have the assessment data and you know what's needed and it's pretty targeted. And in parallel, right, also be planning for some analyses that are gonna show you some of the things that surprised you, right? So they're not mutually exclusive, because you're gonna have to take multiple iterations and multiple cuts at this. And as you see the hydraulics change about sort of one population going down in the deep on the back end of the system, and then you're serving more people in the prevention side of the system, then you have it can get more and more targeted as you go. Other questions or other suggestions for your peers or other places you're stuck? We have about 5 minutes. Katie.
Yeah, hi, I'll lower the hand. I think it feels a little bit overwhelming and a little bit like throwing darts, having to go look at all of the different data sources that are out there and then make sense of them. Like, we compiled all of the different assessments that existed in our county, and I think we had over 80 or 90 that were like multi-page reports that needed to be reviewed. But one thing that I wanted to suggest as a way of honing in on the critical data that we needed is when we did our FFTA directory, we included a capacity question for all of the programs. So how many families or individuals were they able to serve? And now we're going back and we're doing a demand side of, are you at capacity? Do you have a wait list? What are the reasons? Do you have eligibility constraints? And so we're trying to shortcut a little bit to that, not only where are the gaps, but what is the why behind the gaps? And because the program providers know that it's linked, you know, to potential funding or at least attention, they've been pretty responsive.
That's a really great point.
Yeah,
First
I'm
of
glad
all,
you brought up the capacity issue. Every place struggles with understanding capacity, whether that's an annual capacity, a current capacity. It's so critical, right? Because I think a lot of folks get used to there just being a wait list, and that's a sign that there's a capacity problem, right?
Yeah, really great point. And that there's plenty of assessment data to keep you busy for a while if you start to go compile it all. In terms of actually gathering new data. Yeah. About 20 seconds left, everyone. Thank you. for joining us.